Welcome to the Asia Ventilation or AVF Podcast. This is the behind the scenes ICU Stories series. And today we're going to talk about not necessarily specifically critical care, but healthcare in general and the humanitarian crisis that's engulfing Afghanistan today and for the last few months, and probably in the near future as well. Very glad to have two colleagues and friends with us today. We have Mr. Jaffer Shah, who graduated from Hofstra University in New York, where he studied neuroscience. And he's authored multiple publications in peer-reviewed medical journals and works with the Department of Health in New York. He's currently monitoring very closely the COVID situation with public health measures that are being implemented over there. And he's a clinical researcher. He's a statistics instructor and he's a medical journalist with an interest in global health. Also very glad to have Ms. Sara Nabil, who is an artist and an activist, specifically a women's rights activist. And she's doing her master's in visual arts in Germany. And as I understand, both Mr. Shah and Ms. Nabil have roots in Afghanistan and family ties and colleagues and friends back home. So before I go to our two colleagues, maybe I just put things in context. And I think we all know that the whole crisis was aggravated, not that things were fine and dandy before that, but aggravated in August this year when the Taliban took over Afghanistan. We know that before that, 3/4 of the government budget of Afghanistan came from foreign donations. And after the takeover, it literally ceased overnight. So it lost funding from the Afghanistan Bank, from the International Monetary Fund, from the World Bank. And in a report from the UNHCR, or the United Nations Refugee Agency, on the 3rd of December, nearly 23 million people, that's 55% of the population, are suffering from extreme levels of hunger, and it's winter right now. Nearly 9 million are at risk of famine, that's severe, and 3.2 million children are suffering from acute malnutrition. So that's the context, right? It's a humanitarian crisis, it's a healthcare crisis. And one of the main reasons why Mr. Jaffer Shah is here today with us is because he published an article on the 23rd of December in the Lancet Respiratory Medicine journal, in which he and his colleagues discussed the crisis in Afghanistan. So Mr. Shah, could you share some thoughts from your article or beyond on the situation?
Yes, thank you so much, Jason, for introducing us. And, we're just so glad to be here and discuss the urgent situation. We wrote the article in the end of December, and our aim was to highlight the respiratory and critical health concerns in Afghanistan. They haven't received much attention, and we felt that this was an area that we wanted to bring international attention and highlight some of the concerns. Going back even before the Taliban rise, we had the COVID-19 pandemic, and with the COVID-19 pandemic, we saw the healthcare system on the sort of edge of collapse. We already had a huge shortage of healthcare workers, especially in remote areas. But even in main cities like Kabul, we had very few emergency support services. No or very few pulmonologists. I think only about maybe 40 ambulances to serve Kabul, which is like several million. Shortage of vents, shortage of oxygen supplementation. So we wanted to speak about all these issues past COVID as well, and including COVID. We mentioned some of these in our article, and we also mentioned topics outside of COVID-19, like the high smoking prevalence, which surprisingly is one of the highest in the world. Even if you consider war-torn countries like Yemen, Afghanistan still has the highest rate, of smoking. So there's a lot of burden of disease, respiratory disease specifically, and it's not well documented. So, we wanted to, bring these points to attention and focus on some of these. We also discuss issues with children, like you mentioned, about 3.2 million. It's a staggering number that are, on the risk of starvation. According to some estimates, more than, I think, more than half the population is food insecure, and famine is real, very real and urgent, especially with the winter season. It's made even more difficult, with the power outages. So we highlighted some of these very urgent concerns in the article.
Right. Thanks, Mr. Shah. So it's beyond healthcare, right? Pollution, winter, malnutrition, COVID-19, all added together. And I think the best of healthcare systems are going to struggle. And now we are dealing with not the best of healthcare systems. I saw in your article quite a bit of talk about how the healthcare system is really not coping because of healthcare workers burnout, people running out of salary, hospitals closing, lack of supplies. Could you talk a bit about that?
Yeah. So with the change in government, a lot of the funding, as you mentioned, was frozen, and Afghanistan, sort of the healthcare system and most of the government is supported by largely foreign funding. So cutting off the funding had direct impact on, like you said, the salaries of healthcare workers, and just the ability to bring in and import necessary supplies for the hospital staff as well. So it was like compounded by the change in government and the healthcare system already very limited in its capacity.
Right. I could I move to Ms. Nabil? Ms. Nabil, I understand you have contacts in Afghanistan, and could you share what you know of how life is? I mean, to a person like myself who's in Singapore, these are just words on a piece of paper or images maybe on a screen. But how's life actually for a common person in Afghanistan today?
Yeah, thank you so much for having me today here. So I have to say right now the situation is really bad, especially for women in Afghanistan after the takeover of Kabul by Taliban in 15th of August. And it's really bad because the ideology from Taliban ideology is completely against the women. And every day they are making new laws or new regulation for the women. So for example, right now, it's not just right now, it's about more than 4 months that they close the school. This is the basic right of humans. So going to school, to education, work, and bread. It's the basic rights of humans, but they are taking these rights from the women in Afghanistan. Right now, more than 4 million, if I didn't say wrong, it's more than 4 million girls, they couldn't go to school. They just closed the door of school for the people, especially for the women. They couldn't go to the university. They couldn't go to the work. Most of the women, they just lost their families, maybe their father or their brother, and also their man. Mostly people or the families, the women, they lost their man during this 20 years war or before, and they was responsible for their family. But today they couldn't go to work because of this new regulation that the Taliban make for the women, and they should stay at home, and they don't have any bread to how that they could continue their life and their children, and especially also the women's right now. Just about 1 week ago, they make a new regulation that a woman shouldn't go out more than 4 kilometers without having a man. It means if a woman don't have a person that he can that he should be with her, she couldn't leave the home without having a man with her. So it's really, I have to say, I'm really sorry for using this word. It's so stupid, because in 21st century there is people that they are thinking so extremely and thinking like so a stone time. So it's completely, and the people, and I have to say right now, I'm always saying that the women are the most on the biggest group, that they were always the victim of war, victim of the ideologies. And women of Afghanistan today, they went against the victims of Taliban ideology. We had the Taliban in 1996 till 2001, and I as a child, I was in Afghanistan on that time, and I had experience from that time. Still, I have really bad image in my mind from their behavior, how they behaved with the people. Still, I have this image that they cut the hand of the people as they got them punishment, or they just put them on the in the trees to give them the punishment. So, and I had also saw my mother was a really good educated woman, and he's also working in medical area, and she have to stay at the home, and her home was like a prison for her. So this was the experience. But fortunately, in last 20 years, the women of Afghanistan had at least, as much that it should be. We couldn't reach this, but at least we got some rights. We every day, night on day, we fight for our basic rights. Unfortunately, in this 20 years, we reached a little bit in this rights. But today, just in one day, as the fall happened in Afghanistan in 15th of August, it's more than, what I have to say, it's worse than 1996, as the Taliban had the government on that time. And they are always they are saying that they changed, but they didn't change. Even they are very, they got worse. And it is like this. I have mostly, as you introduced me, I'm an artist and also an activist. I have these two big groups, so contact in Afghanistan every day, and I'm also supporting them because they are living under very big fear in Afghanistan, and also threats. So that's why we should raise their voice, and I'm doing this. And it's it's terrible what they are saying and what they are talking to this country. It means it's for me, just when I'm going to hear these stories, it's so hard for me to see that the people they just lost everything. They are just they are saying that they are living, or that they are just live, but they will going to gradually die, because it is like this in Afghanistan. They don't have any right on having it, and doesn't have a right for a person who's has one freedom. It's really hard, and especially for women. It's the situation right now.
Wow, thanks. That's very disturbing. I was just looking at an article from the United Nations Women's paper published in just December this year, and as of 2021, December last year, which is 2021, and the paper stated, and this is from the United Nations, right, that as of 2021, Afghanistan ranked last, 170 out of 170 countries on the Global Women, Peace and Security Index. And something else that's really disturbing, another piece of statistic that says that studies suggest that 87% of Afghan women and girls have experienced at least one form of intimate partner violence in their lifetime? My God, is that your personal experience from what you see?
Yeah, so I have to say, I'm also always, I want to say myself, so how to say, that I was lucky that I born in such a family. At least I don't have this, I didn't have the experience of these violations in the family from my father's side, not from my brother. So because it was equal, everything, they are educated and they know their rights and also my rights, and they give me also. It was completely different for me. It was in the society, going out from my home was completely different reality, but it is the reality. Yeah, the violation or the violence against women is so very, very high in Afghanistan. So most of the women, they had the experience. And one thing I should want to add more, for example, the woman that he had the experience of, I just saw before 2 days ago, there was a, how to say, just sorry, I forgot the word. There was a report from the Euronews, and they make about the women who are living in the safe houses. And right now they lost this opportunity. They are not, and they are also the big victims group, because they was victim as they they had the experience of violence, and they just come to this safe house. But with coming of new regime, there is not anymore this safe house. It means this group of people, or that this group of women, they become again so victim of a new kind of violations, and this is the Taliban. So yeah, but this is the reality. The violence is still, and today I have to say there is more. Yeah, in this 20 years there was something happen. It could be, I could say that it would be better, but at least it was not as a before, but right now I think it's more. And another, it's also really sad because right now there is no one to write about this, to say this is how to say static. So, and I'm sure right now it's more than as a before.
Right.
This violence.
I would just add that, you know, even the rates of child marriage have gone up recently. Yes. I was reading many articles and many personal stories I've heard that, you know, families are put in this difficult situation because of the high rate of poverty and malnutrition. Yes. That, you know, no parent can imagine this, but imagine, you know, having to actually sell one of your children to support feeding the rest of them. So, you know, there's high rates of child marriage, especially women being affected, women being sold off into marriage. The rates have gone high, and, you know, it's received attention, and you know, it's tragic.
Yeah.
That families, you know, being torn because of the hunger.
Yeah.
Oh, Mr. Shah, can I ask what happens? What happens when someone is acutely ill with malnutrition or starvation, or somebody gets COVID? Where do they go? Could you, because you were saying something about the health project called Sehat Mandi, and how it's not coping, and you were saying something like 17% of all the health facilities in this health project from the Afghanistan that was before the Taliban takeover are now only 17% of these health facilities are functional, which means that 83% are not fully functional, and that's a lot of hospitals. And so what happens when somebody is acutely ill now? Where do they go?
That's the thing. There is nowhere to go, and there is no. I would say there's almost no COVID testing. So, you know, a lot of physicians even in Afghanistan, they don't believe that COVID-19 is here. Although, you know, we as an organization, we're seeing COVID-19 patients, but a lot of the physicians, you know, on the ground, they don't think it's affecting the local population. So, you know, there's no rapid tests being done, no PCR, no masks being worn. So, you know, if someone has COVID, they likely don't even know. And they likely are still, you know, if they're going into the hospitals aren't tracking it. There's no log of, you know, COVID-19 positive patients. So, you know, there's the opportunity for, you know, widespread just disease spreading. and there's no infectious disease control measures, and it's not part of the healthcare system or healthcare plan.
Wow. And how about intensive care units? Are they functional? Are they?
No, they're very disintegrated. They're not exactly part of the healthcare system. They're poorly staffed, and the few physicians that are there, are not trained enough, we feel, and very few. It's almost impossible to get in touch with a specialist like a pulmonologist, in Afghanistan. So, if you have severe COVID-19, you might not. You're very unlikely to see an expert, especially critical care physicians. And it's shocking, because you're talking about an area where you have the largest need for critical care, so many patients, population, but no staff and no training, to address it. And, even if you're in remote areas, the situation's complicated even more, because now you have to travel, very unsafe distances to reach few, central locations like in Kabul, where, they have a little bit more capacity, but often this involves, unsafe trips, long distances. So, even the patient's security can't be guaranteed, during these long trips, because often you can't just receive treatment locally, and many patients are hesitant to go to their local clinic, and especially private clinics. They're afraid of the costs, and being able to afford it, and the type of treatment they may receive or may not receive. So it's just a very bad situation for critical care.
Yeah, and I was struck by what you wrote in your article about how, because of the disruption of the supply chain, there's a severe lack of oxygen, ventilators, blood products, drugs, consumables, anything and everything that's needed in an ICU or a hospital.
Even insulin. I mean, it's
Even
very
insulin.
difficult, to come across insulin.
Yeah. Wow. So yeah, I could probably go back to Ms. Nabil, because this is a nice time to talk about what you are also doing for healthcare, and that's Telemed AF. And to my understanding, that's really ground up support for teleconsultation that's free of charge for the people of Afghanistan. Could you tell us more about it, Ms. Nabil?
Yes, of course. We started in 2020 as the corona pandemic started, and it was really bad situation in Afghanistan. As Mr. Shah before get some overview about the situation of them, especially healthcare in Afghanistan. So we started in 2020 with a large group of doctors. We had that on that time, so more than 75 doctors with us. They are all working with us voluntarily, and we started our work in 2020. On that time, we just started with we made a system, and it was working with the Facebook, so through the social media. And fortunately, we were able to give the teleconsultation more than 14,000 people in Afghanistan. It was a really big achievement on that time, because Afghanistan was also, in 2020 was a little bit stable with political situation, but after this, every day it get worse, because the Taliban get more, stronger. And also the people had more problem. They couldn't go to the doctors, so they didn't get to, medical services on the, especially because of Corona was a big threat for the whole world, especially Afghanistan, a country that doesn't have a really good healthcare system. We start on that time, and we continue our work till right now. And because on that time our system was not so very professional, and we just come to the idea to make it a professional. And this year, in 2021, we made our work so a little more professional. We made a website. The name is Telemed AF Afghanistan. .com. So it's Telemit Afghanistan, and that everyone can access very easily. And we just launched our website on 1st of December 2021, and still, right now we have more than about 50 physicians with us, and we just try to cover all areas. Yeah, right now we are just in first step. It's the beginning of our work. We started again more professionally, and we are just providing right now teleconsultation in Afghanistan. But our plan is in future to bring also teledermatology, and also, I just forgot the term. Yeah, but we have some plans to make more this this kind of work so bigger. And right now, so just about it's more than a 1 month, we were able to get services for more than 700 people in Afghanistan. And the second, why we did this, first of all, to give, right now everything is damaged in Afghanistan after the takeover in 15th of August by Taliban, and especially healthcare. Every day the hospitals are getting closed. The people are not, they didn't got their salary. It's more than 4 or 5 months that the physicians or the people who are working in the government and also not, they didn't get their money. And we just start, because the people right now, they are suffering in Afghanistan. So these 38 million people are suffering and they need such as help. So, and we just try to do our responsibility also for our people in this case. And the second goal was with this work, we are also trying to get more women, because right now women they couldn't go to work and they couldn't go to continue their work, and they are sitting at home. And with this platform, we are just trying to give them again this platform to give them this chance to do work. Yeah, right now we are voluntary. We couldn't pay them and we couldn't give them something. But maybe in future, if we're going to grow and maybe we can have some money, or we can pay it also in future. But right now, most of them are voluntary. But at least they are working. They are not sitting at home and doing nothing. But it's something, because they had also some. They feel themselves responsible for their country and for their people, and it's a good platform. The third thing that we want to do it with this work of volunteerism in Afghanistan, the culture of volunteerism. So with such as work, with this kind of work, we are also promoting this culture in Afghanistan, volunteerism. And I have to say, our services are right now completely out of charge. It's completely free and for all people in Afghanistan, and everyone can reach us on get these teleconsultation right now. But I can also give the words to Mr. Shah to describe more about the Telemit Afghanistan, and especially our future plans, or maybe near future plans that we were going to do it as soon as possible.
I would add that, what's truly unique is that we're open to, all Afghans, regardless of, whatever political affiliation, whatever ethnicity. The website's available in multiple languages. We have Pashto, we have Farsi, it'll be in, I think, Uzbek soon, or it's almost translated in Uzbek. So, we're covering all languages, covering all ethnicities. We don't, care about, political views. Our aim is, to just provide access to, medical advice where it's not available. And this is why, we're able to see so many, over 14,000 patients so far. So I think we're trying to fill a gap. We're working on it. I think over 50 physicians verified, and many more applications still that we're trying to verify the degrees so they can see patients. And it's a wide variety of services as well. There's also mental health counseling, and we're going to add a section for women's health. So if you just want to see a woman, you just want to see female physician, you'll have that as well. If if you want pediatrics, they'll have that as well. So, trying to take care of all the different specialties that anyone can access. And so one of the other things we're trying to address right now is the lack of internet, because right now we're largely based on over Wi-Fi, and unfortunately it's not available in large areas because of power outages. So we're trying to work on creating a landline number where you can go to any phone and just call wherever you are and receive medical advice free of charge. So that's the next goal, to make it even more accessible. Because right now we're trying to focus on accessibility and equity. We want people to have access to good medical information, even if they're in remote areas, even if they don't have access to the cities and don't have access to Wi-Fi. So I'm working on this, and the next goal will be to better integrate it with some of the existing infrastructure in Afghanistan. So we're looking at the availabilities of different sites to potentially be hubs, where we can have different services performed, because it's nice to get a prescription, but if you're not able to fulfill it, if you're not able to actually go to the pharmacy, this is one of the largest complaints we're having, that we're writing prescriptions, but nowhere, you can go anywhere, but you can't find the actual medication. So the next step would be to maybe work with local pharmacies, and there's a lot of talks happening right now. Many people are enthusiastic, many pharmacists enthusiastic, to make their medicines available for their fellow countrymen, and to just share their resources, not interested in profit. So that's kind of the next step, to work and make the necessary medications available, and also lab tests. We want to be able to do blood tests and be able to see radiologists. So we need to work with the local already existing systems there. So that's kind of the next goal.
One thing I have to add it. So with this work, especially making the telemed, we did also something more, that's the database. So making a database. Right now in Afghanistan, I have to say, yeah, it happened, but it is not like this. But when you're going to doctor, it means you have to start your story from first. There is no database that the doctor can find your previous problems or can give you advice. With this kind of, with our website, or making this website on with Telemed Afghanistan, we make this also so possible. That means when a person who is coming to us and get this teleconsultation from us, they are going to he is part of this database. It means when he's going to come in 10 years, so when we are going to write his name, then all the data is coming. It's also a big, it's a big step, especially in healthcare section in Afghanistan. So having a database like other countries that we didn't have still in Afghanistan. If we had, it was not so professional or not like this. So
yes, yeah. I saw the website, and it's extremely professional. Yeah. And like what you said, the physicians are from multiple places within and beyond Afghanistan, and the interventions are also not just good old medicine, but even mental health. It's extremely impressive, I must say. Yes.
Yeah. Yes. And I have to say also that more than 65% of our physicians are in Afghanistan. They're from, all of them is from Afghanistan, but they are living also right now in Afghanistan. About 30%. They are living outside of Afghanistan, and they are in different countries. So in Europe, US, and also in Asian. So in different places and every,
Many of the, sorry, I was just going to add, many of the health professionals, they fled. So this is also, an issue we're trying to address. And these are also patients that we see. We do see refugees, who are in other countries, like maybe they went to Turkey, maybe they went to Iran, maybe they went to Europe, and they don't have the proper paperwork, or they're afraid of going to local hospitals, afraid that it might cause them legal issues. So this is an opportunity for them as well, and we do see them. I think maybe 20% of patients living outside of Afghanistan, and they can also receive free teleconsultation.
Yes. It's very inspiring. I was just going to say that one of my favorite books is Thousand Splendid Suns by Khalid Hosseini, right? And I read it a few years ago, clearly before the current Taliban takeover, and I remember it was about 2 generations of Afghans, and it was pre-original Taliban, post-original Taliban, and how resilient the people of Afghanistan were, and I'm sure it's depicting real life and the suffering of Afghanistan people, especially the women, right? And it was so inspiring, and it's sort of come full circle in the wrong way. And I don't know, just reading the book, it told me a lot about resilience and what you guys are doing with Telemed AF, and just trying to do something for the people of Afghanistan. It just sends a very strong message about resilience and humanity. So, I maybe before we end, could you share any final thoughts? Anything you want to share with the audience, or anything you want to let people know about how, if there are people who would like to help, how they could help, bearing in mind that people who listen to this podcast tend to be people in the healthcare space. Maybe starting with Mr. Shah.
Yeah, sure. So, if anyone is interested in helping, we have the website there, telemedaf.com. And, right now we're, working on, maybe making an app and making like Ms. Nabil was saying, the patient database, working on, making sure all the patient data is like we have over here, HIPAA compliant. So, these are all things that, we're working on. And if anyone wants to help, they're welcome to join our team. It's largely volunteers. And, the other, area we're trying to address is, medical equipment and training. If anyone's an expert, we have, a need right now to train both short-term and, long-term training. We need, for the physicians, to teach them, critical care, especially, emergency medical services. So, there's a need right now for experts to come and intervene and to teach, the local population and better equip them. So, if anyone's, wants to help, they can always reach out. And, this would be, we would be very happy to work with them.
Thank you. Ms. Nabil?
Yes, I think, thank you so much. Mr. Shah already said something, but I would like to say something also from my side. I have to say that we just put the first steps to making the telemed in Afghanistan. So it's completely new, and we need really lots of helps in every section. So that our work get more bigger and also effective and also sustainable, and especially to regarding to telemed, as Mr. Shah also said, we need especially for our physicians, so long term and also short terms. The trainings on workshops that they can also got some benefit. They are working all of them so voluntary. And I think the big hope is, or that the most, or the one thing that I want to say, that in this critical time that Afghanistan right now facing, and the people they are facing, that they are going to die more than millions, and it's so really catastrophic time for Afghanistan, for the humans they are living there. And that's why, especially in health section, we need help. So we could be just provide, but maybe to help these people that they are facing die right now, they are dying right now, or they are going to be dying next month. So to help these people to bring some to save their lives. Yeah.
Right. With that, thank you, Mr. Shah and Ms. Nabil, for spending time with us and for doing what you are doing for the people of Afghanistan. I just want to let the audience know that Mr. Shah's article from the Lancet Respiratory Medicine, we're going to post the link on our websites, and this is obviously available on YouTube as well as Spotify. The website address of Telemed AF, that's TELEMEDAF.com, will also be posted on the YouTube and Spotify sites. And please feel free to share, like, follow, subscribe this, and really share it with any of your colleagues who may be able to help in some way or another. To the next time, we'll see you again. This has been the Asia Ventilation Podcast. Take care, everyone.
Yes, thank you.
Thank you.